Good morning. I'm Dr. Suhaimi Osman, consultant cardiologist from Pantai Hospital. I'm practicing in Pantai Hospital Klang. This morning, I will be answering some questions on high cholesterol. And if we can start, I'll go on to the first question, which has been submitted to me. How do I prevent having high cholesterol and reduce my cholesterol level? Okay, I think this is a question that we all really should ask ourselves. Okay, now regular exercise is pretty important. I mean, the more you exercise, the better your lipid profile will be. And I think we usually recommend about half an hour of aerobic exercise a day, 5 days a week. That would be sufficient. If you can't manage that, of course, anything is better than nothing. So regular exercise, and I would usually prescribe about half an hour a day for about 5 days a week. Okay. Diet, of course, is very important. I think we have studied many diets, and we found that the best diet for you to actually reduce your cholesterol and to improve your cardiac health is called the Mediterranean diet. And this diet is quite heavy with a lot of plant-based foods such as vegetables and fruits and nuts. And of course, we advise you to take more fish, less red meat, more poultry and without the skin, which is also permissible. And we normally advise the use of olive oil and some other plant-based oils, which are actually helpful in controlling your cholesterol levels. Now, the thing to remember is that oil actually contains a lot of calories, so you can't actually take too much of it, but it's better to use that form of oil than to use something which is animal-based, for instance. Okay? So, and apart from that, I think diet and exercise and maintaining your weight is also important. Yeah? So just apart from the kind of food you eat, the actual quantity is actually important. Try to maintain your BMI within a healthy range. Try to keep it below and try to make sure it doesn't go into the obese level. And if possible, keep it at a healthy level below 25 at the very for adults and for males, and maybe 23 for women. Try to keep it at a healthy level and try not to exceed the BMI. I think it's quite easy to calculate the BMI. You could usually use a simple formula. You can just refer to the internet. Okay. Other signs that I can look for that let me know I have high cholesterol. There are indeed signs, but these are quite rare in fact, and we call them xanthelasma and xanthomata. They are actually deposits of cholesterol, maybe near the eyelids or on the tendons. They may be found more often in very rare conditions such as familial hypercholesterolemia, where your cholesterol is extremely high. But in the general population, we won't see many signs of this, and even if we do see, sometimes it does not correlate with the level of cholesterol that you may have in your bloodstream. So such signs are really not something of much significance, except in the case of maybe it helps us to detect a condition such as familial hypercholesterolemia, which is quite a rare condition. It's about 1 in 300 to 1 in 500 of the population, but that's something I'll go back into later. Will I inherit high cholesterol from my parents, or will I pass it on to my children? As I spoke to you just now about familial hypercholesterolemia, it is a rare condition which occurs between 1 in 300 to 1 in 500 of the population. You can inherit it from one or both of your parents. Okay, if you get it from one of your parents, hopefully it's going to be a heterozygous condition, and the effect on you is not so great. But even then, the tendency for you to get a heart attack between the ages of 30 and 40 are quite high. If you get the homozygous form of it, then you are in much more trouble, and in fact, you would probably require treatment from a very early age. Therefore, but this on the whole is not the main form of familial hypercholesterolemia. This is not the main form that we inherit, this tendency to have a high cholesterol. I think there is also a polygenic form, which is the one that we most commonly deal with, where there are many genes involved and we do not know which are the specific genes in fact. But these patients would be susceptible to having high level of cholesterol, but that will also depend on other factors, i.e. their diet, the level of activity and exercise, and whether they have any other comorbidities or any other diseases. This form of hypercholesterolemia is quite common and easily treated most of the time, unlike the familial hypercholesterolemia, which is more difficult to treat and may require much more powerful drugs. Okay, so yes, you can inherit it from your parents, either in the polygenic form or in the familial form. Yeah, and the next one is, how often should I check my cholesterol level? Okay, now for adults aged 40 to 75, we are advising that you should check it every 4 to 6 years or every 5 years, whichever you're more happy with. And family members of patients with familial hypercholesterolemia should get checked as early as 10 years old, as 10 years of age. Okay. And those patients who are already on statins or already on cholesterol-lowering drugs should have it checked every year, because we need to ascertain that the dose is correct for you and that you're compliant with your medication. So how often I should check your cholesterol level, how often you should check your cholesterol level depends on who you are and the particular situation you are in. That's it for today. I hope I've managed to answer your questions with satisfactorily, and I hope that this will help you in your future management of your cholesterol and your heart and your cardiovascular health. Thank you.